So I'm delighted to introduce Alua Yeskendir, who is our PhD student UCL, who's going to be looking at social determinants of psychosis. Alua, over to you.
Thank you, James. And hello, everyone. My name is Alua. I'm a first-year PhD student, and the topic of my PhD is examining the causes of health and social inequalities in major psychiatric disorders. Firstly, I will discuss social determinants of mental health and why it's so important to study them today and why they're so important in today's mental health agenda. Well, in general, we used to see mental health problems and mental health diseases primarily as a biological phenomenon caused by biological things, but and for a long time, researchers have been trying to establish biological causes of mental diseases. Last decade, actually, researchers started to pay more attention on social determinants of mental health, and in order to identify how those social determinants are causally associated with the development of mental disorders. And during my PhD, I'm going to focus on one of such factors, which is migration, and why it's so important to study migration and its impact on mental health. Actually, in the last decade, it has been established that the number of forcibly displaced people is continuously growing, reaching the record high in the last year, with an estimated 110 million individuals being forcibly displaced. And considering current conflicts and environmental hazards, it's expected that this number will continue to increase. And in general, migrants, both forced and voluntary migrants, experience lots of stressors throughout their migration journey, starting from the pre-migration period, when lots of them are exposed to war, torture, famine, and forced displacement. And the number of those stressors double during the transit period, when they experience long stay in refugee camps or detention centers, poor living conditions, lack of information, violence and rape, and family separation. And if we think that their conditions become better when they reach the host country, it's not always true, because recent studies have established that migrants experience lots of stressors during the post-migration period in the host country, when they are exposed to long family reunification, which can take not months but years, hostile environments, housing insecurity, job insecurity, and uncertainty about their immigration status. And recent studies even found that those stressors and those disadvantages continue to be important in the next generation of migrants or children of migrants who settled in the host country, when they experience lots of stressors such as generational trauma, living in low socioeconomic condition, and acculturation. Therefore, during my PhD, I am going to focus, and all those stressors finally lead to poor mental health among migrants. And it has been well established that migrants experience higher rates of mental disorders, including psychotic disorders, such as schizophrenia and PTSD. And the increased risk of psychotic illnesses even persist in the next generation of migrants. Therefore, during my PhD, I am going to focus on how variation in migration and ethnicity impacts the risk of development of severe mental illnesses and self-harm. Specifically, I am going to focus on mediative effect of acculturation factors. And acculturation actually is a process or phenomenon experienced by all migrants. And acculturation refers to the process occurring as a result of moving from one culture to and then being in contact with individuals, groups, and societies having other cultural heritage or background. Therefore, those factors are important in shaping migrants' self-esteem and self-identity, which finally can affect their mental health. And specifically, I'm going to focus on post-migration mediation factors such as language acquisition, cultural composition, and socioeconomic deprivation, and how those stressors and how those factors affected the risk of development of severe mental illnesses and self-harm among migrants. Well, thank you for your attention. And here you can see my supervisory team who support me throughout my PhD journey. And if you have any questions or comments, I'm happy to address.